Trade union Nehawu has been highly critical of alleged corruption in the procurement of personal protective equipment, as well as the health department's handling of the COVID-19 pandemic. While Health Minister Zweli Mkhize has today given an update on issues including PPE procurement and relations with labour. But did he say anything that has satisfied the Health Workers Union? Well, let's discuss this. I'm joined by Nehawu's Deputy General Secretary, December Mavuso. December, very good afternoon to you. So you heard the Health Minister give that briefing this morning. Are you pleased that your concerns are getting enough attention?
Well, thank you very much. We have noted the statement given by the Minister. We are, however, worried that the Minister seems not to believe any reports and information has been given by workers and ourselves in the report presented to him last week. Hence, he still wants to undertake an investigation that is going to take 14 days before he takes action. But also, we're not sure if you're going to run an investigation for 14 days, are you able to cover the more than 300 hospitals? So which hospitals are they going to? For instance, we don't believe that you need an investigation to go to Livingston Hospital. The Minister was there, he knows what is happening. He was at George Mukhari Hospital. Workers told him the MEC of Health, December Mavuso, who is now suspended, was with us at the Krizane Paraguay Hospital. He listened to what workers are saying about the PPEs. So we're very concerned that, and we in the statement we have noted also rhetorical statements that are being repeated by the Minister all the time. I've instructed that the Occupational Health and Safety Committees be established. We agreed in April when we meet with him that there's going to be a program to roll out to establish the committees. He has repeated that many times, but he's still instructing even today. And we know nothing is going to happen. So we really need a serious engagement with the Minister. It looks like he can only believe and act on a report that is generated by himself and his team, not based on what workers on the ground are experiencing and have raised with him.
So, December, just on the Occupational Health and Safety Committees, the Minister today said that those should be up and running and fully functional within a week, and that is where the likes of yourselves as Labour will then be able to make inputs and air grievances such as the shortage of personal protective equipment in part. Why don't you think that this time will be different, especially because you did give him that report from your fact-finding mission and a deadline to sort all of this out by latest end of the month?
Well, we don't think there's a commitment to that because if I'm saying we agreed on the 8th of April that they must be established, and he's been repeating that in media all the time. So if he's going to give an instruction that within a week, what is it that is going to happen within a week? Instead of holding people accountable, that a instruction, a decision, a directive from DPSA, from the National Development of Health, from Employment and Labour were issued well in April that this must be established. They are mandatory by law. It has not happened. Take actions. We don't think within a week that is going to happen. Well, good luck to him, but we think these are rhetorical statements.
And December, one of the cases that the Minister made reference to today is of a doctor who's apparently died at the George Mukhari Hospital in Pretoria, also of COVID-19 related illness. The reports there, according to the Minister, is that this is a case that arose as a result, allegedly at this stage, of a shortage in PPE. It brings us back to the question of determining which health workers became infected on duty or people who became infected outside of health facilities, doesn't it?
Look, all workers, in our view, get infected at the health facilities. In fact, we think that hospitals have now become, a source of infections. Last month, I was at George Mukhari Hospital myself. Already at that time, we were told that the 16 doctors were tested positive at George Mukhari Hospital. And when we entered the gates of George Mukhari Hospital, we were not screened up to the point where we entered the office of the CEO. Nobody screened us. Workers were carrying PPEs that we donated at George Mukhari Hospital as a union. Workers who saw us carrying those PPEs were asking us to keep to them. So we can't say that workers are getting infected outside the workplace. Hospitals have become the source of infections because of a lack protection.
I appreciate the point about hospitals being a source of infection. Naturally, December, because there are COVID-19 patients being treated, but is it not unfair to say all healthcare workers become infected on duty because they are members of society who interact with you and I, and we too may be passing the virus on to them?
Well, we have no evidence of that. All we know is that they are asked to work in risk areas in the workplaces without proper and adequate protection. And that's only a reason we can give. As to what happened in the communities, we can't talk about that. But workers are saying we are exposed here. You know, we're made to work even in areas where there was infections of patients. Fumigation is not done the way it's supposed to be done. Workers are made, to continue to work in areas like that. Workers are refused if they are PUIs or they are suspected cases. They are refused to go on isolation. They must continue to work even if after they've tested until the results, comes back. And when they come back after 7 days or so, you find that that worker actually was positive. But he has spent the whole 5 days or 7 days in the hospital.
Final question then. Are you still on course to withdraw labour either at the end of August or early September if you're not happy with the PPE response from Health Minister Mkize?
Our program is on. As I'm speaking to you, we just concluded a meeting, our national meeting with our nurses reps from different provinces. We're meeting the different categories of employees in the health sector and social development throughout the week in preparation for our National Day of Action.
December Mavuso, Deputy Secretary General or General Secretary of the Health Workers Union, Nehawu, thank you.